Hey, everybody, welcome back to the Speak and Grow Rich podcast. Today, we have a really special guest with us who is actually a cardiovascular nurse practitioner, and her heart is to help entrepreneurs like you and me watching speakers who are running and gunning and going for it in life, prevent a heart attack, prevent strokes, and have an incredible, healthy life for the passion that we pursue. So welcome, Dr. Gina.
Thank you so much. I'm thrilled to be here, Amanda. Thank you for having me.
My pleasure. So how did you narrow into this specific niche? Why are you on this path?
Well, when I graduated from nursing school, I was drawn to the critical care unit, mostly because I worked as a nurse's aide when I was in college. And I wanted to learn how to read those, what was called telemetry at the time. But, you know, when a person sits at the front desk at a hospital unit and watches the heartbeats go across the line. So I wanted to learn how to read those. It was just intriguing to me, and I was drawn to critical care. And so then when I graduated as a nurse, I went through a critical care internship at Baylor University Medical Center, downtown Dallas. And it was a great experience. I spent 25 plus years in the critical care unit, coronary critical care unit, where people come in with heart attacks. They come in and end up going to the cath lab, which is where we do heart procedures in the hospital, go to bypass surgery, have stents, etc. And I loved it. But I began after about 15, somewhere between 15 and 20 years of that, I started to realize that patients would come back, most of them again and again and again. So after the first stent, coronary stent, or the first procedure, we'd need another one. Or the first heart attack, they would come back with another one. Or someone would have a heart attack and then come back with a stroke. And two, it seemed like became just a steady stream of people coming into the hospital in the emergency room.
People. Steady stream. Okay, keep going. I'm sorry, but I was just seeing the money. I'm seeing the money. Okay.
So I part of my job then when I became a nurse practitioner and continued to work in the hospital was to go down to the emergency room when someone came in having a heart attack or suspected heart attack, and help make sure they got the appropriate testing and got, in a prompt way, got the right meds, got the right care, obviously just help facilitate all of that. And then go back while there was nothing happening in the emergency room to discharge people that were, ready to go home after having their heart procedure or whatever, recovering from a heart attack. So it got to the point where it was difficult to have time to go to discharge people because I kept getting called back to the emergency room, or I was just stuck in the emergency room because it was, as I said, a steady stream of people. So it was a sequence of events where one 45-year-old gentleman that came in with the worst presentation of a heart attack really got my attention one day. And mostly I remember as I was driving home that day thinking, you know what, I'm about 45 years old too. If I don't figure this out, not only am I not going to really help patients if there is any answer to keeping people out of the hospital, but I'm going to be one of these patients if I don't figure this out. So that's why I got take a deep dive into learning what's really available in terms of preventing heart attacks and strokes. And so now I have my own clinic, and that's what I do full time is see people, many of them, fortunately or unfortunately, it's because they've had a heart attack and they say, I just can't ever let that happen again, or I'll lose my business. I worry about what's going to happen to my family. I might lose my life. So I say most people don't realize that the biggest threat to your business is a heart attack or stroke, because 1.6 million people a year, just in the United States alone, just the United States, we're not talking the world, will have a heart attack or stroke, and 750 plus thousand of those individuals won't survive it. And so it's incredibly important that we seek this care if you know you have cardiovascular disease or if you've had a heart attack. But for those of us that want to protect our business and our families and our life and are proactive about our health, seek this out early, because there is a way to know if you're headed for a heart attack or not. And you can turn that around. It's the technology we have available today is incredible to be able to know where you stand and then look again later and see if you're making progress.
Incredible. So what can we do to prevent it?
Yeah. So I say we know a lot of the things that we need to do to prevent it. Of course, we know we need to exercise and maintain a healthy weight. We need to eat healthy and have a lot of information on all of those topics. But
Mhm.
we can do everything right and still have a heart attack if we don't get the right tests. I think it's incredibly important that we actually know what's going on inside our body. I'll give you an example. I don't know if anyone listening to us today has listened to the show that I don't think it's any longer airing, but there was a show called The Biggest Loser.
Oh yeah.
And remember that show?
Yes.
And Bob Harper, the celebrity fitness trainer on that show,
Yes.
one of them, he had a heart attack on the treadmill. He
What?
lived, he survived it, but he was the
Oh,
fittest man in America, right? You
no,
know,
that's
really,
incredible.
yeah. And I can't tell you how many times I have people come in and they say, so and so had a heart attack, and we all thought he or she was the healthiest person on our block or the healthiest
Right?
person in our church or whatever. So you can do everything right, but without really
Yeah.
understanding where you stand with your heart, you can still have a heart attack. And then part of the problem is you don't get all of the tests, or maybe you get the wrong tests. And I have one other example of that. I don't know if you remember Tim Russert, another celebrity. He was on Meet the Press every Sunday, a very popular news anchor. And he had just had an exercise stress test a few weeks previous and died suddenly of a heart attack after he was told everything was fine. So what we know now is if you go to the doctor and you have a cholesterol check and a blood pressure check and your weight's checked, those are not wrong. They may check even, blood sugar,
Mhm.
triglycerides, more blood work. That's great, but it's not complete. It's not wrong. It's just incomplete. So you need a comprehensive test panel, comprehensive evaluation, and then you need somebody that knows how to customize your treatment plan based on the findings to ensure that when we look again, whether it's a few months or it's a year, or depending on what is found, will determine how often we need to look at things. So when we look again, we should be turning you away from heading towards a heart attack. Or if everything looks great in the beginning, or there's a few small things, we should make sure you never head towards a heart attack.
Mhm.
Um, so comprehensive evaluation, customized treatment plan, and then I say you need a calendar to
Okay.
track your data, because if you can track that, yes, I'm going in the right direction, then you can get back to focusing on your business. You can get back to spending time with your family and kind of put that problem aside. Don't let it keep you up at night. It doesn't most people until it happens the
Right.
first time. Or maybe there's someone, a lot of people start to get to be an age where they know their parents had a problem with cardiovascular disease, or someone they
Mhm.
love. They're like, I'm about that age. Maybe I should start checking into it.
Okay, so we need these three C's. And then
Yeah.
what do we do? At what age do we start this tracking and these tests?
Yeah. So one of the pieces of technology that we have now, I interviewed the chief medical officer of the company. It's on my YouTube channel. But this isn't in like, you won't find this if you open up an American Heart Journal or in most of the magazines that you're reading and that kind of thing. But he and I and many others that are doing this type of work agree that these tests are needed by age 40 at least, because
Wow.
heart disease, which is basically a problem in the heart arteries, in its vascular disease, it's atherosclerosis, plaque in the artery wall, and it develops because of a problem actually in the blood. It's a topic maybe for another day or a topic later, but um, now that we have the technology to actually, with just simple CAT scan technology, look at your heart arteries and tell you with minute detail if you have any plaque, and if so, how much of it. And most importantly, is it a dangerous type of plaque?
Mhm.
Is it a moderately risky plaque, or is it scar tissue? Because we would love for everybody age 40 and above to have no plaque. But if there's plaque and it isn't all scar tissue plaque, then that's our number one target, our number one goal. So our targets in the past have been wrong. Like Tim
Mm.
Russert. his target was to pass a stress test. He did, but that wasn't the best test. You have to look where the problem occurs, define what it looks like, and then go to work with all the lifestyle things and the other findings we uncover in the blood work to reverse that process. Because if any plaque that's there becomes scar tissue plaque, it's just like a scar on your hand. Or if you've ever cut your skin, you can look years later and say, yeah, that's where it happened that day. But it's not a problem. You know, it's never going to cause you a problem the rest of your life. That's how scar tissue plaque is. Body has the wonderful capability to do that. But if you don't know it's there, you don't know that it needs a little attention.
It's so good. So how do we know what tests to take?
Yeah. Okay. So there's 5. And so everyone can take out a pen and paper and just write these down or put them in their phone. So one is you need to know what your heart arteries look like, the arterial test. And that's done with a CT. So that's everybody's probably had a CAT scan or you've heard of a CAT scan.
Yes.
You go to an outpatient radiology center, a doctor has to order it, and get what's called a coronary. So that means the heart arteries, coronary CT angiogram, the arteries.
You have this written down too, like in a free gift.
Yeah. People can get a free copy of just what I'm telling you. In fact, I'll send them videos with the information that they sign up to get them, and it comes as with an explanation.
Okay, good, because these are some big words for us with our pens and papers. Okay, keep going. So we've got the first one.
Heart with a particular type. Let's just say that. Yeah. Number 2, you need this one may surprise everybody, but you need a home sleep study. Because maybe you think you sleep pretty well. Maybe you wear an Oura ring or a Fitbit or a wearable that tells you how your oxygen is at night or tells you if you're sleeping well at night. But many of us are mouth breathers at night, or we do have reduced oxygen at night. And that's a huge risk factor for not only high blood pressure. Most of us know sleep apnea, for example, the worst kind of decreased oxygen at night, increases your risk for high blood pressure, cardiovascular disease, and congestive heart failure. So you want to know early, but we now know it's not just sleep apnea, yes or no, it's a continuum. So if you have several times during the night where your oxygen level drops, that needs to be addressed, because whether you're age 30 or you're age 95, we can improve. Again, remember how I said that the plaque starts to build up because of what's in the heart. It also builds up because what's not in the heart. If you're not keeping steady levels of oxygen in the blood, what's in the blood. So if you're not keeping steady levels of oxygen in the blood 24/7, it's a problem for the heart. Okay. So a home sleep study will tell us that. Any information you can glean off of your wearable device, like an Oura ring, is also valuable. Then the third thing you need is, believe it or not, we need saliva. You need to spit in a cup. And the reason for that is there are 5 bacteria that they're in the body, but we can detect them in the mouth because commonly they're correlated with either periodontal disease or some type of problem occurring in the mouth. And sometimes you don't even know. Go to the dentist regularly, you're healthy from the standpoint of your gums and your teeth. You can have one of these bacteria and they get into the blood and they play a key role in plaque formation in the wall of the artery. So CT scan, home sleep study, a saliva test, and then thirdly, you need to know, fourthly, thank you. You need to know where you stand in terms of your blood sugar, your glucose. And my favorite way to really get an understanding now is to just put a continuous glucose monitor on a person. Are you familiar with a continuous glucose monitor? So it's a little device that was originally developed for patients.
I've seen those, yeah.
Yeah.
And you put circular.
Yes. And it measures your glucose level all 24/7. You wear it for 14 days.
Okay.
And we can tell from that if you are insulin resistant, pre-diabetic, or diabetic. In other words, you can be insulin resistant, just meaning your cells are not really taking up the insulin and glucose like they should for 10, 20, 30 years before you ever go to the doctor and they say, wow, your fasting blood sugar is high. You have diabetes. Well, where did that go? How did that happen? It's been brewing for years and years and years. So there's other ways you can do it at too with a finger stick glucose machine that you can get at the pharmacy at home. We mostly want to know what your blood sugar doing after you eat, because
Okay.
we've been relying on the fasting blood sugar for years, and the fasting blood sugar can be correct for a long time, and it's misleading us. So that's
Mm-hmm.
the fourth thing. Know what your glucose is. If you also
Okay.
had the capability on your annual blood work to get an insulin level, fasting insulin level, that will give us a lot of clues about how your glucose insulin regulation is going.
Wow. Okay.
The last category is just kind of a broad category of blood work that tells us sources of inflammation. And there's too much to go through on this call for everything that's on that blood work, but it's everything from vitamin D levels to a deeper dive into your cholesterol, the good and the bad cholesterol, the triglycerides. What does all that mean? It's a deeper dive into this topic we just talked about, the insulin and glucose relationship. It's other nutrients, it's your electrolytes, it's several cardiac markers that aren't routinely done on an annual blood test. So to recap, 5 tests: CT of your heart, specific type, a home sleep study, a saliva test to look for bacteria, a continuous glucose monitor, or a way to determine where you are in terms of insulin and glucose. And then fifthly, you need blood work with a complete blood work panel.
Wow. So this is interesting because I'm sure a lot of people get their annual testing if they're a lot of people don't get their testing, but you get it, but then they do not customize a plan, and they also don't even, I guess, help you understand it. They just,
Yeah.
oh, here's everything that looks fine, and they don't give you any more information. So is
Yes.
this what you do in your business? You help
Yes,
entrepreneurs
it
and business
is. And
owners?
a lot of people call me and they say, I've had a lot of testing. I think I've had that done. And you're right. So what I offer is for people like that say, I don't know if I need your services or not. I say, send me all your stuff, and you just hire me for a one-time fee. I call it a review of records, second opinion consultation.
Uh-huh.
They
That's
send me all
good.
their, and I study it, and then we have a consultation over Zoom if they're not local. And those are the type of comments I get is, wow, I didn't know you could glean all that from that lab work I had done. I was just told it looked okay. And,
Right.
I can tell them if there are things that are lacking or not. And a lot of times they say, I understand what I have had done far better than
Right.
before I talked to you. There's a lot we can
That's
glean, just most of the time you aren't given that information.
And so your website is thepreventclinic.com?
Yes, it is.
Okay, that's super. Everybody run and get that. As we speak, my car is in the shop and my car is getting this diagnosis. It was 200 plus registration, $400. A few weeks ago, a radiator broke on it, and that was another 600. So $1,000 just to maintain this car that transports me from here to there. And a lot of people, I'll just call myself out as well, we're not taking that our own body seriously, our own health, because I feel like people think, oh, it will never happen to me. That
Yes.
won't happen, that won't happen. So I encourage everybody to get these tests. And what would you say are the next best steps for everyone? If they don't
Yeah.
would they go to their doctor and then they consult you, or do you do these tests as well? Do you have to be in person?
Yes. So either way, like I say, they can bring what they have, or they can take it to their doctor. And if they don't like the answers they get, they could consult with me at that point. Or we take people where they are, and we fill in the gaps for what they haven't had, and then really develop a plan where you can go back to, like, after you get your car all fixed up, you're just going to drive it. You're not going to worry about it. We want you to feel that way about your body and your heart. You've gotten your confidence, clarity about, okay, this is what my heart looks like now, and all the contributors to the disease are handled. I'm good. And you get back to focusing on your business, which is what we all want to do, on the impact we want to make in the world, knowing that your business is protected from heart attack now, as is your family and your life. Yeah.
So good. And I feel like if y'all who are watching this is a blessing, and it's here for a reason. So the fact that you're here watching this, take it as a sign. Go get this blood work done. Go download this, the cheat sheet from Dr. Gina on the 5 different tests at the Prevent Clinic. Is there anywhere else that we can stay in contact? You said you have a YouTube as well?
I do have a YouTube channel. It's Dr. Gina Pritchard, DrGina Pritchard. I went back and got my doctorate degree. You're right. I'm a cardiovascular nurse practitioner with my doctorate degree. So that's why the DR is in front of it. And follow me on YouTube, on Instagram with that same name as well.
Hey, thank you. All right, everybody, run out and get these tests. Take it as a sign. I love your heart and your passion to help other people, Dr. Gina, and I appreciate your time for being here, helping all of us stay healthy and stay alive. Stay alive. Until next time. Thanks for watching, and I'll see you in next week's video.